Outcomes. Now, this is the second principle in the voice framework. And outcomes ask a simple but important question. What changed because nursing acted? Nurses perform important duties every day. They educate patients, attend councils, complete audits, coordinate care, develop policies, and advocate for change. But completing an activity does not automatically mean the intended result was achieved. Take shared governance as an example. An organization may establish a council, schedule monthly meetings, and ask nurses to submit concerns. The council exists, the meetings occur, and the minutes are completed. But has nursing practice actually improved? That is the distinction at the center of outcomes. Activity tells us what nursing did. Outcomes tells us what difference the activity made. A meeting is an activity. The resolution of a safety concern is an outcome. An education session is an activity. A patient understanding how to manage their care is an outcome. So with shared governance, the real questions are not simply how many meetings were held or how many concerns were submitted. The real questions are, were concerns acted upon? Did nurses receive feedback? Did the workflow improve? Did care become safer? And did nurses trust the process enough to keep participating? And this connection should be made before the activity begins. If the council is created to improve nursing practice, then the expected outcome should be defined from the start. What should be improved? How will it be measured? And how will nursing know whether the council made a difference? Nursing outcomes are also broader than patient measures alone. Nursing activity may affect safety, access, staffing, retention, cost, workflow, education, public health, and community well-being. The activity may happen in one place, but its consequences may reach across the entire system. So how do nurses apply outcomes? Start by naming the activity. Then identify the result it is intended to produce. Choose evidence that can show whether the result changed. Take action and evaluate whether the improvement actually occurred. For example, do not stop at saying, "We provided discharge education." Ask whether patients understood the plan, obtained their medications, attended follow-up appointments, and avoided preventable readmission. That work matters, but connecting the work to the result is what makes the nursing's value visible. Nursing does not lack value, but nursing often completes the activity without clearly demonstrating the outcome. Outcomes change that. It connects what nurses do to what improves, what harm is prevented, and what value is created. The activity shows the work the nursing team completed. Outcomes show the difference nursing made. That is outcomes.